Let's bring in Fox News medical correspondent Dr. Marc Siegel. So, Doctor, what is the president's health plan exactly, and will it work?
Well, David, it's piece by piece. It's not one whole plan, but I'll tell you something. He ended with the words Medicare Advantage there in the clip. Medicare Advantage is huge. It's expanding. You're seeing 1,200 more choices on Medicare Advantage this year alone, and decreasing premiums. Medicare Advantage, 28% since 2017. Costing less, more options. You got to like that. And for seniors, more price transparency, less surprise bills, and as I just said, more choice. So that's the privatization of Medicare. That's actually been extremely popular and has been making money for everyone and saving seniors money. I like that he said that. And by the way, I cannot resist an opportunity here to say that Medicare for All is not even Medicare. Because when you go to extend Medicare across the country to everyone and you knock out the employer-based health care system, you're talking about something that ends up being so highly regulated and restricted that it's more like Medicaid than Medicare. It's not going to be the Medicare that seniors know.
Jonathan?
Dr. Siegel, it's Jonathan Honig. Thank you for being with us. Aren't the Republicans a little bit hypocritical here? I mean, if Medicare is good, if the president is fighting to save Medicare, then to play devil's advocate, why not Medicare for all, which is what all the Democrats are advocating for? The Republicans say they love Medicare. Well, if Medicare is great, why not Medicare for all?
Well, Jonathan, I think the answer is that the Medicare he's trying to save is the one with, again, more private options, a larger Medicare Advantage, more and more expanded Medicare Advantage. Medicare Part D, which wasn't popular when it was first passed under the Bush years, actually, it has gone down in cost as well. More options with Part D, more privatization of Part D, more choices in drug prices coming down. Again, it's piece by piece here, and every piece I like. The price transparency piece, the choices piece, the no surprise bill piece. So it's not that he's extending the Medicare as you know it. It's changing Medicare into something that's more workable. And let's not forget the most important piece of all, me as a practicing physician, Medicare pays me less. Medicare for All will pay me 40% less, not to mention what it will do for hospitals who are already used to eating it on Medicare and getting less money. If they lose privatization, private health insurance, some of them are going to go belly up.
Doctor, I think that's the key point that you just made. You know, people always say, oh, Medicare is cheaper than private insurance. That's because private insurance subsidizes Medicare. If you get rid of the private insurance, right, then there's nobody to subsidize the cost of Medicare. But I think you made a really important point that, you know, for all this idea that Trump isn't doing anything about health care costs, that's wrong. He has all these programs that give people more choices, allow people to opt out of Obamacare. And it sounds like what you're describing is very much an extension of that, of let people have other options to reduce costs.
I think also, can I just weigh in? I mean, I agree that we're talking about political issues here, right? I mean, this is probably the #1 issue, healthcare, coming in terms of policy for 2020. I just think this was an incredibly brilliant salvo because Trump is going to run against socialism. What is more socialist than Medicare for all? And as he starts talking about Medicare being under threat from that, I think all those older voters who, by the way, already vote Republican, generally speaking, they are going to be incentivized to come to the polls. This is, I mean, I hate to say it, but nothing is going to be done now that we don't talk about through the prism of the 2020 election. And I think what you said is absolutely right. The more you can draw a contrast between Medicare and Medicaid all that.
And let's not forget the money, Liz, let's not forget the money's coming out of the taxpayer pocket, right? So $30 trillion in transition fees. Start asking a working class person about that, whether they want that. And then the Medicare that the senior has and doesn't end up being the Medicare they end up with. And I forgot to mention generic drugs, which are being approved at an unprecedented rate, which is finally flattening out prescription drug prices.
Do you support, the president supports Governor Ron DeSantis of Florida in terms of importing drugs from Canada because they're cheaper. Do you support that as well?
I do support that. But I like better, and I've said it here on this program, I like better the idea of export taxes. I don't want to have to play catch-up, because the problem with reimportation is we can't vouch for the quality. And we're already having problems with contaminants getting into prescription drugs coming in from other countries. You know, we've been talking about that all week with Zantac. We've been talking about that with the blood pressure medicines I use. I like better export taxes to prevent the drugs, to prevent foreign countries from gouging us in the first place. Having said that, if we can't get there, I think we have to do something to even the playing field.
Could that be encompassed in the USMCA then?
Absolutely.
Is that?
Absolutely. And I believe it could be across the board with private insurance as well. I don't think it has to be only Medicare. One of the things we always forget is when we talk about negotiating, we're only talking about Medicare. And of course, Medicare negotiating across the board is going to decrease quality, and we're going to lose innovation that way. So I am not supporting Medicare negotiating all drug prices.
Jonathan?
Dr. Siegel, the president also made a big point today of emphasizing that Republicans would protect individuals' right to have health care even with a pre-existing condition. You know, previously only Democrats had talked about that. Do you see any unforeseen consequences? Doesn't that essentially constitutionalize health care as a right if anyone can get a health insurance even with a pre-existing condition?
Jonathan, I think the president's been pretty consistent on this. I think that he's always backed, well, for the most part, backed pre-existing conditions. But let me remind you that there's another way to do this other than making everybody buy into Obamacare, one size fits all. That theory, right? That, in other words, if you live in the desert, you have to pay the same for flood insurance as if you live on the coast. I don't believe that. I'm a person that believes if you have a Chevy, we want you in the pool, but we don't want you paying a Ferrari rate. Here's what I'm saying.
Analogy.
Let me translate that into David loves analogies and metaphors. Let me translate that into healthcare terms. It means high-risk pools. It means that instead of subsidizing a one-size-fits-all insurance, let the government pay for people who can't afford insurance, give them some policy, and reinvent high-risk pools, this time properly funded.
Steve, I got to ask Steve a question because the president was clear today. He made a case to the people out there, to the voters, saying, look, it sounds nice to have all this free stuff, whether it's Medicare for all or student loan debt excused or whatever it is, but it just can't happen. There aren't enough taxes to pay for how much that would cost. You'd have to tax everybody 100% in order to pay for it all. Do you think that message will get through? I know it got through to the seniors that he was talking to. Will it get through the majority of voters?
Yeah, it will. And Liz is right. You know, Democrats understand that this issue of Medicare for all is an albatross around their neck, and it's not going to work politically. And, David, I have to say this. The doctor gets an A in economics today. You're fantastic
he's
on this stuff. You get it perfectly right.
All right.
I want to end by saying that the Pony Express is not Federal Express. So the government can't fix it. The government can't fix it.
I like that.
All right. Another metaphor from the doctor.